The FDA has regulation now over e-cigarette products in general, and that means they're finally getting a good hard look at the risks and dangers of these products. So the FDA told Juul they could no longer market this product at all. These e-cigarettes produced by that company, which is also owned by a big tobacco company, have been shown to cause youth vaping use. They've been shown to get kids addicted to nicotine, and that can create a lifetime habit. So pediatricians and public health folks everywhere are rejoicing for this ruling. There was such a steady reduction of smoking as people realized how harmful and damaging it was to the lungs. But with the e-cigarettes, they were really marketed as something that supposedly was safer. That has not been shown to be true. Nicotine is essentially a pesticide from the tobacco plant, and it's a highly addictive pesticide. So these products are actually getting people to be dependent on this noxious pesticide that is one of the most addictive compounds known. One of the other points the FDA made is that the flavorings and additives to these compounds are also not safe. And the flavored products are the way that youth have been suckered in. I mean, cigarettes taste terrible. You know, they're not the kind of thing that youth are keen to do. But when you make what Juul did was creme brulee flavored nicotine, that's how they sold their products. Well, a lot of the chemical additives there are known carcinogens and are getting deposited into the lungs and may not even come out. I expect the FDA to look more broadly at other e-cigarette companies and e-inhalation companies that use these kind of flavoring products and mechanisms to get young people to be dependent on their products. So that's what we can look forward to. A second point is that the rise in e-cigarette use has come along with COVID. So precisely the time when we need to protect our lungs with this viral process, we're having this new increase in vaping use, which essentially kills the little villi and so on that clean the lung from products, and instead are depositing oily gook right into your lungs where we don't have good ways to get it out. The use of e-cigarettes can also harm brain development. It's been shown to impact memory and behavior. It has cancer-causing ingredients, and it actually alters the pathway of the developing brain in a way that can promote addiction and dependency later on. So no parent would want this for their kid, and adults should be thinking hard about this product as well. So unfortunately, pediatricians are seeing more kids who have a real dependency to e-cigarettes, to the point where they can't go to school without it. It's being done in the bathrooms. It truly is a dependency. I'm encouraging parents to be knowledgeable, to be able to recognize and identify these products. So if you see them, you know what they are. Second, see your pediatrician. There is now a nicotine therapy that some kids have needed to be able to break this addiction. And just know that almost every child who starts using these products in a daily fashion, they are still users today. That's how powerful the dependency is. So if your child is using this on a regular basis, even once a day, that kid is going to go on to use this, and many of those kids convert to cigarette use later.